Composite bonding. If you're one of those people who have gaps between their teeth and they're visible and you don't like them, you might go to the dentist asking for options. What can I do to close these gaps? Now, you have usually two options only. Either you bring your teeth together and close those gaps with orthodontic forces, which is braces or Invisalign, or you're gonna close the gaps by putting something in those gaps, filling the gaps basically, which will be composite bonding or porcelain veneers. In this video, I'm going to explain for you how composite bonding is done. But please be aware that you have to consult your registered health professional, dentist or orthodontist, for what's good for you. In dentistry, we don't have one size fits all. If you do orthodontic treatment and braces or Invisalign, your teeth will come together, your bite will be hopefully correct, so you have a lot of clinical benefits from it. Where when you put in composite bonding or porcelain veneers, you are just making your teeth look bigger to close those gaps. These are restorations that need to be changed during your lifetime, so that's not something that I would say is forever. Now let's have a look at some composite bonding treatments that are done by some of my colleagues. Doing composite bonding, composite is a polymer material. It's a dental filling. It's what the dentist uses as white filling when you have a cavity. We can mold it, we can shape it, we can play with it and get it the shape we want. The good thing about it that people really like is that it's really non-invasive. So unless your teeth are sticking out, you don't have to be worried about your teeth having to be shaved or trimmed down. We can just add the composite to the spaces of your teeth and a little bit on the front surface of the tooth and make it look like your real tooth. The bad thing about it is that it will change color quite sooner than porcelain veneer or even your own teeth. You have to be very careful. It's not as strong a material as your own tooth or as porcelain veneer, so it can chip and break and separate. It's not something that the dentist can prevent. It's just in the nature of the material. Now, at the consultation appointment, the dentist usually would put some composite on the surfaces of your teeth to be able to show you how your teeth are gonna look like after we have added the composite on. Keep in mind, if you have really large gaps, we might not recommend putting composite or even porcelain to close the gaps. We might recommend using orthodontic forces to close the spaces as much as possible. Why is that? Because if your teeth are really far apart, we add to each tooth is going to look really large and a bit funny and not nice at all. But if the gaps are small, we could add composite slowly to each tooth, make it slightly look bigger. Now, as I said, the good thing about composite is that you don't need trimming, shaving, any trauma or invasion to the tooth. We can just treat the tooth using a gel and a bond and then put on the composite. We polish it really well. And then after that, that's it. It's done and you can go home. Usually you don't need any numbing or injections. How can you take care of your composite bonding? You have to treat it like your own tooth. Floss as regular, brush after you floss, and see your dentist regularly. Ask your dentist to polish your composites almost once a year, if you can once every 6 months. Why do I say that? As I mentioned before, composite has a tendency to get a lot of stains because the material itself is very porous. So stains and color can go inside and get trapped. Your composite can look dull and dark and stained after a while, especially if you are having a lot of staining food. How can you prevent that? You can't avoid every food that has stain in it. And people usually think, well, I don't have much coffee. It's not only coffee or red wine, it's every food that has color in it. Basically, if you're only on a white rice diet, then you should be fine, but you can't do that, right? So what I recommend is see your dentist every 6 months and maybe every year ask for a composite polish. That way, the pores of the composite that have stains on them will be polished flat. Another layer comes off smoother than the front layer, so it'll look shiny, nice, and also not stained. Obviously, after a while, which would be on average 5 years, you have to have your composite changed again. Thank you so much for watching. If you want to see what's the difference between composite and porcelain, have a look at the video I'm gonna tag above.